Hello, I'm Trisha Harms, and this presentation is about an interview with a community policy leader. The issue that I'm covering is overprescribing and abusing controlled substances. The interview was with Liz Porter, who is the head pharmacist of Carl T. Curtis. This is for class Nursing 940 at Morningside University for Dr. Jackie Barber. The current issue that has been noticed over the past few months is overprescribing of controlled substances and using above the recommended dose. There's also been noticed that there's been more inappropriate medications prescribed for chronic pain management. The current policy does define acute and chronic pain, goals of pain management, defines limits for acute and chronic pain management, has a pain contract and a urine drug screen. The current medication policy actually does not have any inclination of prescribing more than needed for like benzodiazepines or ADHD and ADD medications. Issues that were noted during the interview with the current policy were that some medical providers actually don't comply or even know about the policy, not enforcing pain contracts with pain medications, difficulty determining if there is pain contract due to the old electronic health record, and tracking down the hard copy of the pain contract. Another issue is trying to get an accurate medication list, so then this may cause overprescribing of medications that way as well. Ways that can be done to address overprescribing. The pharmacist had said that she is going off of the FDA and drug manufacturers' recommendations. She's not allowing anything that is going above and beyond what is recommended, or the off-brand use. If this were to happen, it is addressed with the provider by a phone call, educating the provider, and then if neither of those things work, that pharmacist that got that prescription actually may decline to fill it because it's also at their license in the issue as well. There has been discussion about implementing a policy directed towards overprescribing. For example, most recently there were some issues with wanting to have a provider prescribing Vyvanse for over 100 milligrams, and looking on Up to Date and other medical journals, it is not recommended. So that's kind of where this is all stemming from. There is the prescribing drug monitoring program. Some of us do have ability to check this to see what their patients are getting from other clinics, but the downfall is that other clinics can't see what is being prescribed at Carl T due to the program that we currently have for electronic health record being incompatible with that PDMP program. Another thing that was brought up that I noted in some of my research is prescription behavior surveillance system. I did ask the pharmacist about this program, and she said that due to not very many, not having over 10 providers at the facility, that it wouldn't be useful, and they do more of that themselves. That's why that program is not used. So there are currently 3 pharmacists actually in the clinic. The clinic has a community health clinic, dental, behavioral health, and dialysis, along with a nursing home. In conclusion, I felt the interview went pretty well. I did feel comfortable discussing the issue at hand with the pharmacist, and it was helped that she kind of knew what was going on as well. I think if it was someone that wasn't familiar with the process and the policies, the interview may have been a little bit difficult trying to explain everything and then having that background information so that they would be able to understand. It also did help having a list of questions ready to discuss during the interview. I feel I do need to work on interviewing other people that aren't familiar with policies in the healthcare clinic or world to help me feel more comfortable addressing those issues. I actually kind of enjoyed doing the interview. Thank you.